Have you ever come home from a perfectly nice walk with your dog, unclipped the leash, watched them shake themselves off the way they always do, and then just stood there watching them do something that made you simultaneously cringe and laugh and worry all at once? They sat down, right there on your entryway floor, and they started dragging themselves forward with their front legs while their hindquarters stayed on the ground. Scooting. That unmistakable, undignified, carpet-grinding motion that your dog performed with complete seriousness while you stood there holding the leash you had not quite put away yet. Maybe you laughed the first time. Most people do. There is something about the visual of a dog scooting that hits a particular funny bone before the concern catches up. You shared the video with someone. They sent back laughing emojis. But then it happened again after the next walk. And the walk after that. And now it has been happening consistently, predictably, almost ritually, every single time you come through that front door and unclip the leash. Walk ends. Dog scoots. Like clockwork. And the laughing has stopped. Because somewhere in the pattern, the worry moved in. You started watching them more carefully during the scoot. Noticing the focus on their face. The deliberateness of it. The fact that they are not doing it playfully or randomly. They are doing it because something back there is uncomfortable enough to demand immediate attention the moment they stop moving. You checked the area. Maybe you saw nothing obvious. Maybe you saw a little redness. Maybe you caught them licking the area afterward and the licking was too focused, too persistent, too purposeful to ignore. And now you are here. Because something your gut already told you at walk number 3 is being confirmed by walk number 7 and walk number 12. This is not random. This is not funny anymore. This is a pattern. And patterns in your dog's body are always signals. The only question is what signal this one is sending and how urgently you need to respond. Here is what that signal almost certainly is. And here is exactly what you need to check tonight before a manageable, entirely correctable problem becomes something significantly more painful and significantly more expensive to resolve. Hello everyone. I am Dr. Marcus Reed, and welcome back to Paw Secrets Lab. I have spent over 14 years in veterinary practice with a specific focus on gastroenterology and internal medicine in dogs. And I want to tell you something that most dog owners discover far too late. Scooting is one of the most misunderstood and most consistently underestimated behaviors in companion animal medicine. Most people who see their dog scooting assume it is either worms or something funny. And because it does not look like an emergency, because the dog seems otherwise fine, because it is frankly a little embarrassing to bring up at a veterinary appointment, they wait. They watch. They hope it resolves on its own. And in that waiting, a problem that would have taken one veterinary visit and a dietary adjustment to resolve becomes an impacted gland. Then an infected gland. Then an abscess. Then a rupture that requires surgical intervention, prolonged antibiotic treatment, and a recovery period that your dog finds genuinely miserable. What if I told you that the cause of post-walk scooting specifically, not random scooting, not occasional scooting, but consistent, predictable scooting that happens after every single walk, is almost always the same identifiable cause? And what if that cause has a precise, at-home check you can perform tonight that tells you exactly what you are dealing with and exactly what needs to happen next? Today at Paw Secrets Lab, we are going to cover this completely. Here is exactly what we are covering together. In Chapter 1, I am going to explain the anal gland anatomy and the post-walk trigger. You are going to understand exactly what anatomy is involved, why walking specifically triggers the scooting response, and what is happening inside those glands when the behavior becomes consistent and predictable. In Chapter 2, I am going to reveal the 4 causes of post-walk scooting. Because while anal glands are the primary culprit, there are 3 additional causes that produce an identical behavioral pattern and that require completely different responses. In Chapter 3, I am going to teach you the Tonight Check. This is the precise 5-minute home examination sequence that identifies which of the 4 causes is driving your dog's behavior and tells you exactly what level of urgency applies. And in Chapter 4, I will walk you through the dietary and lifestyle reset, the specific changes that address the root cause of recurrent anal gland problems rather than simply managing the symptoms each time they appear. Subscribe to Paw Secrets Lab right now and join our extraordinary, growing community of educated, devoted dog parents. Get something to write with because what you learned tonight is going to change how you think about this problem permanently. Let us begin. Welcome to Chapter 1. The anal gland anatomy and the post-walk trigger. To understand why your dog scoots specifically after walks and what that timing tells you about what is happening inside their body, we need to start with the anatomy that most dog owners have never had explained to them clearly. Your dog has two small glands located just inside the opening of the rectum. If you imagine a clock face centered on your dog's anus, these glands sit at approximately the 4 o'clock and 8 o'clock positions, just slightly inside the anal opening, embedded in the surrounding tissue. Each gland is roughly the size of a small grape in a medium-sized dog, slightly smaller in small breeds and proportionally larger in large breeds. These glands, called anal sacs, are lined with specialized secretory cells that continuously produce a fluid. This fluid is not waste. It is not a byproduct of digestion. It is a highly complex, individually unique chemical secretion that serves as your dog's biological identity document. The specific chemical composition of each dog's anal gland secretion is as unique as a fingerprint. It contains information about the individual dog's sex, reproductive status, health status, and identity. This is precisely why dogs greet each other with such focused and seemingly undignified interest in each other's hindquarters. They are reading a biological data file that contains more information about the other dog than a handshake ever could. In a healthy dog with healthy anal gland function, these glands empty naturally and automatically during bowel movements. When a firm stool passes through the rectum and out through the anal opening, it applies lateral pressure to the gland openings on both sides simultaneously. That pressure squeezes a small amount of the gland's secretion out onto the surface of the stool as it passes. The dog marks their stool with their individual chemical signature. And the glands are emptied, or at least partially emptied, in the process. This natural expression system works beautifully when several conditions are met. The stool must be firm enough to apply adequate lateral pressure. The gland ducts must be open and unobstructed. And the gland must not be producing secretion faster than it is being expressed. When all three conditions are met, you never know the glands exist. They function silently and invisibly in the background of your dog's biology. But here is what happens during a walk that makes the post-walk scooting so specifically informative. Walking involves sustained rhythmic muscle contraction through the hindquarters, the hips, the thighs, and the pelvic floor. This sustained muscular activity creates rhythmic pressure changes in the tissue surrounding the anal glands. In a dog whose glands are functioning normally and emptying adequately, this is irrelevant. The glands are not full. There is nothing to respond to. But in a dog whose glands are incompletely expressed, either because the stool is too soft to create adequate natural pressure, or because the gland ducts have become slightly narrowed, or because the glands are producing secretion faster than they are being emptied, the glands accumulate fluid between natural expression events. They become distended. Not yet impacted. Not yet infected. But full. Uncomfortable in the way that any full, pressurized space in the body is uncomfortable. And when walking then applies that sustained rhythmic muscular pressure around an already full gland, the gland is stimulated without being fully relieved. The secretion is agitated. The surrounding tissue is activated. And the moment your dog stops walking and the external pressure is removed, the discomfort and the urge to relieve that discomfort becomes immediately apparent to them. They sit down. They scoot. They are trying to create the friction and pressure that will trigger the gland to empty, or at least to relieve the building discomfort. The post-walk timing is not coincidental. It is anatomically precise. It tells you that the glands were already full before the walk began and that the walk activated rather than resolved the problem. And it tells you that the natural expression system is not working adequately for your specific dog. Welcome to Chapter 2. What is actually driving the scoot? Anal gland dysfunction is the primary cause of post-walk scooting. But there are 3 additional causes that produce an identical behavioral pattern and that require completely different interventions. Treating all scooting as an anal gland problem and missing one of these 3 alternatives can allow a different condition to progress while you focus on the wrong system. Cause number 1. Anal gland impaction and dysfunction. This is the cause we explored in Chapter 1, and it is responsible for the majority of consistent post-walk scooting. The glands are full, improperly expressing, and the walk is the physical trigger that brings the discomfort to the surface of your dog's awareness. The specific distinguishing characteristics of anal gland impaction are these. The scooting is most intense and most consistent immediately after physical activity, specifically after walks. Your dog licks the anal area with focused persistence, particularly in the evening when they are resting and the external stimulation of activity has stopped and the internal discomfort becomes more noticeable. When you look at the anal area, you may notice slight asymmetrical swelling on one or both sides of the anal opening, one side appearing slightly more prominent than the other, indicating unequal gland fullness. The secretion, if any is visible, is brownish, thick, and intensely fishy in smell. And when you gently feel the area on either side of the anal opening, which I will show you how to do safely in Chapter 3, a full gland feels like a firm, grape-sized, pressurized structure that your dog may flinch slightly when you palpate. Cause number 2. Perianal fistula. This condition is less common than anal gland impaction but significantly more serious and frequently misidentified as an anal gland problem in its early stages. Perianal fistulae are chronically infected, tunnel-like tracts that form in the tissue surrounding the anal opening. They are more common in certain breeds than others, with German Shepherd dogs having a profound and well-documented genetic predisposition to this condition that makes perianal fistula the first differential diagnosis in any German Shepherd presenting with perianal discomfort. The distinguishing characteristics that separate perianal fistula from anal gland impaction are these. The skin surrounding the anal opening appears visually abnormal. Not just slightly red or irritated but pitted, ulcerated, or containing visible small openings in the tissue, the fistulous tracts, that may have discharge associated with them. The odor associated with perianal fistula is distinctly different from the fishy smell of anal gland secretion. It is a heavier, more purulent, infection-type odor. The condition causes significant pain. Dogs with perianal fistula frequently cry, whimper, or show extreme reluctance when anything approaches the anal area. They may resist sitting, strain during defecation, or show dramatic behavioral changes around toilet time. And crucially, the condition does not respond at all to anal gland expression because the glands themselves may be secondary to the primary fistulous disease. If you have a German Shepherd or any dog showing these specific characteristics alongside the scooting behavior, please make a veterinary appointment urgently. Perianal fistula is a progressive, painful condition that requires prescription immunosuppressive therapy and sometimes surgical intervention. It does not resolve and it does not respond to dietary modification or at-home management. Cause number 3. Intestinal parasites. This is the cause that people most commonly assume is responsible for scooting, and it is actually less frequently the primary driver than anal gland dysfunction. But it is a real cause that produces real scooting and that requires specific treatment. Tapeworm infestation specifically, rather than roundworm or hookworm, produces perianal irritation through the migration of tapeworm segments from the rectum to the perianal skin. Tapeworm segments are mobile after they are shed. They move. And that movement on the sensitive perianal skin creates an itching, crawling irritation that dogs respond to by scooting. The identifying characteristic of tapeworm-associated scooting is the presence of tapeworm segments visible in the fur around the anal area or on fresh stool. These segments look like small, flat, white or cream-colored rice grains that may be moving when freshly shed or dried and immobile when older. If you see these segments, you have your answer. Your dog needs deworming with a product specifically active against tapeworms, which requires a veterinary prescription in most cases, and you need to identify and address the source of infestation, most commonly fleas, which serve as the intermediate host in the tapeworm life cycle. Cause number 4. Allergic perianal irritation. The fourth cause is the most overlooked and the most frequently responsible for chronic, recurrent scooting that partially responds to anal gland expression but returns within days or weeks of each expression. Food allergies and environmental allergies produce perianal inflammation through the same immune-mediated inflammatory cascade that causes generalized skin inflammation elsewhere on the body. The perianal skin is a particularly reactive tissue zone in allergic dogs, and it frequently becomes the primary or sole site of allergic skin manifestation in some individuals. The identifying characteristic of allergic perianal irritation is its pattern of recurrence. A dog whose scooting returns within 1 to 2 weeks of professional anal gland expression, despite adequate stool firmness and no evidence of parasites, almost certainly has an allergic component driving perianal inflammation that is making the glands fill faster than they naturally should and making the surrounding tissue hypersensitive to the sensation of full glands. Addressing the allergy, through dietary elimination trials or environmental allergen reduction, is the only intervention that breaks this cycle at its root. Welcome to Chapter 3. The Tonight Check. I am going to walk you through a safe, gentle, 5-minute home examination that identifies which of the 4 causes is most likely driving your dog's scooting and tells you exactly what to do next. You need 2 things: a bright light or your phone's torch function, and a pair of disposable gloves if you have them, though they are not strictly required for the external examination I am going to describe. Find a calm, well-lit location. Have high-value treats accessible. Work slowly and gently throughout. If your dog shows any sign of significant pain, any yelping, any sharp flinching, any extreme resistance at any point during this examination, stop immediately and make a veterinary appointment today. Pain during a gentle external perianal examination indicates a condition that has already progressed beyond home assessment. Examination Step 1. The visual survey. With your dog standing calmly, lift the tail and examine the perianal area directly under your light source. Look specifically for these 5 things. First, any visible asymmetry on either side of the anal opening, one side appearing more swollen or prominent than the other. Second, any visible pitting, ulceration, or small hole-like openings in the perianal skin that would indicate fistulous tracts. Third, any visible discharge around the anal opening that is not normal stool material. Fourth, any rice grain-sized white segments in the fur around the anal area or on the anal opening itself. Fifth, any generalized redness, inflammation, or skin thickening of the perianal skin that extends outward from the anal opening in a ring pattern. Photograph everything you observe under the light. These photographs will be valuable at your veterinary appointment in ways that verbal description alone cannot match. Examination Step 2. The gentle external palpation. This step is performed with clean hands or gloved hands. With your dog standing, use your thumb and index finger to gently apply light pressure to the tissue on either side of the anal opening at the 4 o'clock and 8 o'clock positions. You are feeling, not pressing deeply, just light external pressure to assess whether you can detect any firm, pressurized, grape-sized structure beneath the skin's surface at those positions. A normal, adequately expressed anal gland at these positions will feel soft, almost undetectable, like normal tissue. A full anal gland will feel like a firm, discrete, pressurized lump just beneath the skin's surface, distinctly different from the surrounding tissue. Do not attempt to express the glands yourself. External expression performed incorrectly can rupture the gland internally, drive infection deeper into surrounding tissue, and cause significantly more damage than the impaction itself. Note what you feel and report it to your veterinarian. Examination Step 3. The stool assessment. Think carefully and honestly about your dog's recent stool quality. Has it been consistently firm, well-formed, and easy to pick up? Or has it been softer than normal, less formed, or variable in consistency from day to day? Soft stool is the single most common underlying cause of inadequate natural anal gland expression and chronic gland impaction. If your dog's stool is regularly soft, you have identified a primary contributing factor that dietary modification can directly address. Examination Step 4. The parasite check. Examine 3 to 4 recent stools immediately after your dog defecates, before the stool changes from environmental exposure. Look for any visible movement in or on the stool's surface. Look for rice grain-sized segments in the fresh stool. Look for any visible worm-like structures of any size in the stool material. Also examine the fur around the anal area and base of the tail for the dried, sesame seed-sized remnants of tapeworm segments that have been shed in previous days. A single positive finding here is sufficient to conclude parasitic involvement and to prompt a veterinary appointment for appropriate deworming. Examination Step 5. The recurrence pattern review. Ask yourself honestly, has your dog had their anal glands expressed by a groomer or veterinarian in the past? If yes, how long after expression did the scooting return? If the scooting returned within 1 to 2 weeks of expression, allergic perianal irritation is a strong possibility and should be discussed specifically with your veterinarian at your next appointment. If the scooting returned after 4 to 6 weeks, dietary fiber modification is likely the primary intervention needed. If this is the first episode of scooting you have observed, the urgency is lower but the baseline examination is still valuable. Welcome to Chapter 4. The Dietary and Lifestyle Reset. For the majority of dogs whose post-walk scooting is driven by anal gland impaction secondary to inadequate natural expression, there is a root cause solution that reduces or eliminates the recurrence cycle without requiring repeated veterinary expression visits. That solution is dietary fiber optimization. The connection between dietary fiber and anal gland health is direct and mechanistic. Adequate dietary fiber produces firm, bulky stools. Firm, bulky stools apply adequate lateral pressure to the anal gland openings during defecation. Adequate lateral pressure produces natural, complete expression with every bowel movement. Naturally expressed glands do not impact. They do not cause scooting. And they do not require manual intervention. Here is exactly what to add to your dog's current diet to optimize stool firmness and support natural gland expression. Plain, pure canned pumpkin at 1 to 4 teaspoons per meal depending on your dog's size is the most effective, most universally tolerated fiber addition for dogs. The soluble fiber in pumpkin absorbs water in the intestinal tract, producing stools that are firmer, bulkier, and more effective at natural gland expression than the stools produced by low-fiber commercial dog food alone. For dogs with chronic recurrence who do not respond adequately to pumpkin alone, adding a psyllium husk supplement at a veterinarian-guided dose provides additional soluble fiber that further optimizes stool consistency. Always introduce fiber supplements gradually over 1 to 2 weeks and ensure your dog has access to adequate fresh water throughout the day, as fiber requires water to function effectively in the gut. If your dog's scooting has an allergic component, work with your veterinarian to implement a dietary elimination trial using a novel protein or hydrolyzed protein diet for 8 to 12 weeks. This is the only reliable way to determine whether food allergy is contributing to the perianal inflammation cycle. Alongside dietary modification, ensure your dog is receiving regular appropriate exercise which maintains healthy intestinal motility and regular bowel movement frequency. Both factors support natural gland expression indirectly by ensuring that expression opportunities, meaning bowel movements, occur regularly and with adequate stool volume. Before we close, I have a critical professional obligation to tell you when the scooting behavior has progressed beyond home management and requires urgent veterinary attention today. If the anal area is visibly swollen, hot to the touch, and your dog is in obvious pain when you approach that area, the gland has likely progressed from impaction to infection to abscess. An anal gland abscess that ruptures through the skin is a painful, contaminated wound that requires surgical cleaning, flushing, and antibiotic therapy. Do not wait for this to rupture. Call your veterinarian today. If your dog is straining to defecate, producing only small amounts of stool with obvious effort, or crying during defecation alongside the scooting behavior, the impaction may be severe enough to mechanically interfere with normal bowel function. This requires same-day assessment. If you see blood in the stool, blood around the anal area, or any discharge from visible openings in the perianal skin, call your veterinarian today. These findings indicate tissue breakdown and infection that require professional treatment without delay. You came here today because a behavior that started as something that made you laugh has become something that makes you worry. Because you counted the times. Because you noticed the pattern. Because your instinct told you that something happening this consistently, this predictably, this specifically after every single walk is a signal from your dog's body that deserves a real answer rather than an embarrassed look away. You were right to count. You were right to notice. And you were right to come here. Your dog cannot tell you that there is a pressure building inside two small glands at 4 o'clock and 8 o'clock positions just inside their anatomy. They cannot explain that every walk makes the fullness more noticeable, and that the moment the leash comes off, their body demands they do something about it. They cannot describe the discomfort of tissue that is full and pressurized and waiting for relief that never quite arrives. All they can do is scoot. Right there on your entryway floor. With complete seriousness and complete trust that the person watching them will eventually figure out what they need. 1 teaspoon of plain canned pumpkin mixed into their food tonight. A careful visual survey of the perianal area with your phone's torch. An honest assessment of recent stool quality. A veterinary appointment this week if anything in the tonight check pointed toward impaction, fistula, or parasites. These are not overwhelming interventions. They are precise, appropriate responses to a clear, readable signal. You read the signal. That is everything. Tell me in the comments below. How long has your dog been scooting after walks? And after working through the Tonight Check in Chapter 3, which of the 4 causes do you think you are dealing with? Your answer will help me give you even more specific guidance in the reply. And it will help every other dog owner reading these comments tonight who is watching the same pattern and wondering if they are the only one. If this masterclass turned a confusing, embarrassing behavior pattern into a clear, actionable understanding, please tap the like button. It tells the YouTube algorithm that practical, specific, root cause veterinary education matters and carries this video to the dog owners who are watching their dogs scoot right now and have no idea what to do about it. Subscribe to Paw Secrets Lab and join our incredible, compassionate community of educated dog parents who refuse to look away from the signals their animals send them. I am Dr. Marcus Reed. Add that pumpkin tonight. Do that tonight check. And make that veterinary appointment if anything you found points towards something that needs professional eyes on it this week. Your dog has been telling you something after every single walk. Tonight you finally know what it means. I will see you in the very next video.